continue our journey this week to salute the ordinary Indians who are striving to spark a revolution through their inspiring ideas. We bring you stories from Mahindra's Spark the Rise campaign, a platform to propel innovation and entrepreneurship. Meet this group of women from Chitrakoot district who are shaping the lives of many other Dalit women through their weekly newspaper, Khabar Lehriya. Get a look at the user-friendly services offered by Seva Mob to the villagers residing in Kakori and Mohanlalganj near Lucknow. Be inspired by Ayappa Masagi, who has created better water management practices through his rainwater harvesting system. And meet Dr. Parvez Ubaid, who is bringing affordable, inclusive and accessible eye care to those who need it the most. Nestled in the Chitrakoot district of Uttar Pradesh, the small town of Karvi is witnessing a silent change. The Dalit women in this area learning to read and write. Heralding this change in the male-dominated town is a group of women who are shaping the lives of many other women through the weekly newspaper Khabar Lehriya.
खबर लहरिया शुरू करने का एक तो पहला मकसद था कि महिलाओं को पत्रकारिता में आगे लाना। दूसरा था कि जो गांव स्तर में दूर दराज के ऐसे इलाके हैं जहां पर पाठन की सामग्री नहीं पहुंचती है, उन इलाकों में हम एक अखबार पहुंचाएं और उन लोगों को भी अखबार के माध्यम से प्रेरित करें जो कभी अखबार नहीं पढ़ते हैं या उनको मौके ही नहीं दिए जाते।
चित्रकूट जिला बहुत ही पिछड़ा इलाका है। यहाँ पर ज़्यादातर उच्च जाति का दबाव है। महिलाओं को भी काफ़ी मतलब उस तरह से परेशान किया जाता है और ऊंची जाति का ज़्यादा दबदबा है। इस कारण से थोड़ा इस चित्रकूट जिला में थोड़ा बदलाव आया, इसके लिए ये पेपर शुरू किया गया है।
In the patriarchal system, where there is no space for women's news or work, these women are changing the media and information landscape through the rural weekly. So these rural women report, write, edit and distribute the newspaper. Printed in the local language Bundeli and Vajika, this one-of-a-kind newspaper reaches out to 30,000 readers in 700 villages of Uttar Pradesh and Bihar.
खासकर तो जो ग्रामीण क्षेत्र में अखबार जाता है तो उसके लिए तो बदलाव है ही है। जो अनपढ़ महिलाएं पढ़ती हैं और सुनती हैं, फोटो चित्र सब देखती हैं और जैसे हम लोग जाते हैं तो कुछ हमें दे करके उन्हें बदलाव आता है कि ये लोग काम करती हैं और हम लोग क्यों ना पढ़ें, क्यों ना लिखें।
So stories of topical importance that do not find space in the mainstream media are covered by this group of determined Khabar Lehriya reporters. Nothing comes easy. Equipped with just a pen and notebook, they walk several kilometers every day to find a story which is eventually printed in Allahabad.
पत्रकारों के लिए तो हमेशा चुनौती भरा ही होता है, लेकिन ये जो चित्रकूट डिस्ट्रिक्ट था एक तो पिछड़ा इलाका है, शिक्षा का स्तर बहुत गिरा हुआ है, तो ऐसे इलाकों में महिलाओं को काम करना, दूसरा वो दलित महिलाएं हैं, अल्पसंख्यक हैं, आदिवासी हैं और ऐसे मतलब ज़्यादातर महिलाएं कम पढ़ी लिखी हैं, तो ऐसे इलाके में और जहाँ पर उच्च वर्ग के पुरुष पत्रकार हैं उनके बीच में रह के काम करना और जो 10वें इलाका है ये चित्रकूट, दूसरा जो दबदबा इलाका है उस बीच में अगर महिलाएं कुछ काम करती तो उनके लिए बहुत मुश्किल था। हमने मतलब हर एक खबर के लिए झेला है। किसी ने गालियां देने को तैयार हो गए तो किसी ने तमंचा निकाल के हमारे सीने से लगाया तो किसी ने लाठियां दिखाई, मतलब इस तरह की परेशानियां झेली हैं शुरू में हमने। लेकिन आज वही लोग पुरुष जो है हमारा काफ़ी सम्मान करते हैं और काफ़ी अच्छे से वो हम लोगों से बातचीत करते हैं और यहाँ तक कि अन्य अखबार वाले हमसे खबरें लेते हैं।
Getting financial support from Nirantar, a Delhi-based center for gender and education, Khabar Lehriya is now an 8-page newsletter which initially started as a 2-page newsletter. Disseminating information in the hinterland of Karvi, Khabar Lehriya has not only impacted the lives of marginalized families but of women reporters too.
काफ़ी, एक तो पहले मैंने बहुत छोटे छोटे बच्चे थे तो परेशान रहती थी और पति से भी परेशान रहती थी। अब अलग हो करके जब काम करने लगे तो काफ़ी अपनी हिम्मत बल आया, हिम्मत आई। जो लड़काई में हो गए तो भूल गए, लेकिन अब हिम्मत से अब अकेले रही, 4 बच्चों को जी आई, उनको शादी ब्याह सब करी और कुछ मतलब सहयोग मायके का मिला, कुछ मेरा था। तो अपनी हिम्मत से मैंने बहुत बड़ा एक काम किया है, जो आज चैन से रहती हूँ, मकान बनवा ली हूँ।
शुरू से ही सुनती थी कि हर क्षेत्र में जो है वो महिला काम करती है, लेकिन पत्रकार जो वो महिला नहीं होती है। तो मैंने एक जो ये शब्द यहाँ से जब मेरी ट्रेनिंग हुई थी तो ये निकला था कि हर क्षेत्र में महिलाएं होती हैं लेकिन पत्रकार नहीं होती। तो वो वाला शब्द जो है मुझे बहुत मतलब मेरे मन को छू गया था और मैंने भी ठाना था कि चाहे जैसे भी हो मैं भी पत्रकार बनूंगी।
These women have achieved what many of us with sufficient resources have been unable to. Determined to make something of their lives, they are certainly introducing a new wave of journalism and a new wave of courage. A villager getting medical assistance at his doorstep. A farmer being able to seek advice from an agricultural expert. These are some of the things that Seva Mob has brought into the lives of those residing in the villages of Kakori and Mohanlalganj.
Seva Mob provides a healthcare and insurance to low-income group consumers by the team of the doctors and the field representative. They carry Android tablet with them and supported by 24/7 call centers, MBBS doctors, pathology centers, clinics.
At a subscription of just 100 rupees a month, villagers are entitled to a monthly visit by a doctor who not only carries out a routine checkup but also informs them about preventive methods.
कोई इनकी क्रॉनिक बीमारी है तो उसको भी बताता है, अगर ज़रूरत पड़ती है तो उनके पैथोलॉजी टेस्ट भी कराता है। इफ़ रिक्वायर्ड दे रिकमेंड टू द वेरियस स्पेशलिस्ट ऑल्सो। तो ऑल दो बेसिकली दे वी प्रोवाइड एंड टू एंड सोल्यूशन एट द डोर स्टेप।
हमको तो अच्छा फायदा लग रहा है इस काम में। दवा इलाज जैसे कोई तकलीफ होती वो लिख देते हैं और होती तो पास तो दे देते हैं, नहीं होती तो लिख देते हैं।
Seva Mob has also started offering healthcare services to schools in the village of Kakori.
जहाँ किसानों के बच्चे हैं ये लोग ज़्यादा जानते तो हैं नहीं, ज़्यादातर गांव के लोग हैं, तो इस संबंध में उनको नॉलेज नहीं है कि क्या खाना चाहिए क्या नहीं खाना चाहिए। तो वहाँ पूरा दिन खाना खाते रहें या पूरा दिन छोड़ दें, खाना न खाएं, कोई जरा सी दिक्कत हो खाना छोड़ दिए। तो इस लिए जो है ये लोग अपना ठीक से जो है इनको बताए कब खाना चाहिए कब नहीं खाना चाहिए, क्या खाना चाहिए क्या नहीं खाना चाहिए और बीमारी से कैसे बचा जा सकता है, इस संबंध में इन्होंने बहुत अच्छा बताया।
They have touched the lives of farmers who now have the facility to consult field operators about their crop cultivation. Even animal husbandry services are just a phone call away.
उनके पास एक्सपर्ट्स रहते हैं जिससे वो हमको सही जानकारी दे देते हैं और सही सलाह देते हैं, जिससे हमारे जैसे हम अपने बागों में मकड़ी के जाले की परेशानी आ रही थी तो वो जाले सही इलाज नहीं हो पा रहा था, कैसे ये ख़त्म किया जाए। तो इनके वैज्ञानिकों से दवाएं पूछी हैं और उन्होंने कुछ उपचार बताए हैं तो जिनको इस्तेमाल किया है और जिससे आज जो है बागों में जाला बहुत कम है। हमारे जो जानवर हैं, भैंसियाँ हैं और बकरे हैं, इनकी भी जो इनके एक्सपर्ट हैं जानवरों वाले वो भी मदद करते हैं। अगर कुछ मेरे जानवरों को परेशानी होती है तो वो भी देख लेते हैं, उसके बारे में दवा बता देते हैं।
Seva Mob has been able to revolutionize the lives of around 1700 villagers in less than 14 months. It is a great cause coupled with remarkable results. After the break, find out why this regular-looking man is hailed as the doctor of dry borewells.
Community people have called me a doctor of dry borewell. Why? You know, I'm recharging, I'm sustaining the barren borewells or dry borewells. Once I go to the spot, I know what to do done for this charging the borewell. I'm just like a working as a doctor. That's what they called me. You are a doctor of dry borewell.
and meet a doctor whose vision of accessible eye care solutions has benefited thousands of people.
So after passing out, I decided to come back to my hometown and not work somewhere outside Assam as most of my friends did. And having come to Assam, I worked in various hospitals and then realized the areas which need addressing right now.
While deficient rainfall has damaged countless crops, leaving the farmers in India distressed. There are thousands fleeing their homes due to massive flood waters every year. Striving hard to overcome the water crisis of the country, to reclaim the dying wells and preserve rainwater, Ayyappa Masagi quit his job as an engineer to establish the Water Literacy Foundation.
Facing a lot of water problem in my own farm actually. I have Arakanat farm, so I faced a lot of water problem. Then I lost my 3 acres Arakanat plant also. Actually, to save my own farm actually, I started this rainwater harvesting. So after my this one, I think 2007, I done the system, all the lakes, everything actually I done my all the actually subsoil charging, subsurface charging, groundwater charging, everything I implemented in my own farm. After 2 years, my farm became a very water abundant water, rich water became. Then I started actually to why not to spread this across the community and the farmers. Then I quit my job. Then I started this for giving water literacy for farmers.
By teaching the poor farmers to take charge of the water resources in their community, Ayyappa hopes to build sustainable resources using his systems of rainwater harvesting.
Lack of awareness only we are facing a problem. So I started conducting programs for farmers and education, then exposure visit and this one. Then farmers, more and more farmers are coming forward to take up my suggestion and my activities. Till today, in this connection, I conducted 2089 water literacy programs. Charge the water, how to use the water, how to conserve the water. One more program we have actually water literacy on wheel. It's actually water literacy on wheel is an actually vehicle four-wheeler. There we have all water literacy related to water literacy books, then CDs, then pamphlets. Then you have a teaching aids like LCD and all. Then evening, you'll go, why not the people are actually free from evening, no? That time you'll go there, then you set up our system, then just will give the awareness program.
From setting up better water management systems in villages, Ayyappa took the literacy program to the next level by focusing on the industrial projects in cities.
Industries have a lot of money. So nowadays actually started for industries, we are taken up more and more industry projects. Why, you know, industries are actually buying water. Where they are buying? Actually not buying, they are stealing actually farmers' water. Indirectly they are stealing. So for that actually I plan to make industry self-sufficient. Why I said self-sufficient? Once the industry becomes self-sufficient, what happens? He stops buying water.
We formed a water policy. We formed a proper measuring system. We track the water on a routine basis. And all these things have really happened after Mr. Masgi came in contact with us. He has really sensitized us. He has really made us the impact which we can make positive as well as negative. His association has brought us, not only to us, for the company as a whole, for the community as a whole and the larger benefit of the society. This is going to be a benchmark across the world for understanding how a process innovation can happen and make a company water positive.
Improving water conservation technologies in farms and industries, and transforming the farmers and his employees into water warriors, Ayappa Masagi has implemented rainwater harvesting projects in 11 states in India.
Community people have called me a doctor of dry borewell. Why? I'm charging, I'm recharging, I'm sustaining the barren borewells or dry borewells. Once I go to the spot, I know what to do done for this to charging the borewell. I'm just like a working as a doctor. That's what they called me. You are a doctor of dry borewell. Earlier our aim was water efficient India, but now our aim is to water efficient globe. That means if you go with our system, the people will not face any water problem. For this we need actually water literacy. Literacy is the main tool.
Entering the Limca Book of Records in 2012 for the highest number of artificial lakes constructed, Ayappa Masagi has greatly inspired and instilled the culture of water preservation among rural and urban communities. A doctor of dry borewells indeed. Jorhat could be just another ordinary town in India. But this doctor and his team are doing their bit to make sure that with their effort, lives of the people of Jorhat is a touch extraordinary.
I am from Jorhat basically, so after passing out, I decided to come back to my hometown and not work somewhere outside Assam as most of my friends did. And having come to Assam, I worked in various hospitals and then realized the areas which need addressing right now, and that made me open ERC as such.
Their vision, quite literally, is simple yet far-reaching. Affordable, inclusive and accessible eye care facility for the people of Jorhat across the strata. That includes consultations at just ₹50, optical retail starting at ₹99 and cataract surgery starting at just ₹3,500.
Eye care as such for Jorhat is not a problem if you talk about the city itself, because there are very good hospitals and NGO hospitals, government medical colleges there. The problem is with people who are just around Jorhat, 30 kilometers, 40 kilometers from Jorhat, who has no access to eye care of any kind.
With 3 eye care centers up and running in Jorhat, Dr. Parvez is a busy man. While he handles the main consultation work, he also has 2 ophthalmologists on board and 3 visiting eye care consultants to handle complicated cases. And while the centers are pretty popular and are attracting a lot of patients, it's really the eye care camps that are organized by his team of doctors that is making all the difference to the people who couldn't even imagine paying for eye care facilities.
अच्छा भी है, वो देने के लिए भी प्रॉब्लम नहीं होता है, लेकिन यहाँ से जोरहाट जैसा डिब्रूगढ़ जाने के लिए बहुत खर्चा होता है। वो चश्मा का जितना दाम है ना, वो आने जाने में खर्चा पड़ जाता है, इसलिए हम लोग बहुत अच्छा लगता है ये कैंप।
Helping patients see better and improve their quality of life may be rewarding, but is not without its challenges.
The main challenge right now for us is financial, because investors are a bit wary of coming to Assam, considering the bad press Assam gets every now and then. So although we have engaged with a few investors both from Europe and India, So although the European investors are not that wary, but Indian investors, they assume that Assam is a very difficult place to live.
His office may be tiny and dingy and packed in the middle of the crowded bylanes of Jorhat in the heart of Assam. But for the young, old, rich and poor of Jorhat, their only ray of hope.